and welcome back to the first video in the third lecture on Covidenomics. In this video we're going to look at the endgames for the virus. Unless we know where we're trying to get to, we're very unlikely to get there, or as John Daly from the Grattan Institute said in this article in The Conversation, we need to choose an endgame, the appropriate interventions, public health, government spending, freedom of movement and so on, all depend on the endgame we choose. Now John looked at three particular endgames. Endgame C was his elimination strategy. I'm going to actually look at four. So let's start off with endgame 1. That's going to be elimination. To eliminate the virus, we need to reduce the exposure rate and the probability of infection to get beta, our reproduction number, less than 1, and we need to keep that in place until the virus is eliminated. How do we do this? Well, we're going to need pretty strong restrictions on movement until we get a period of time, say 3 or 4 weeks, where there's no new cases reported. We're going to need most businesses to close. So it's not simply a case of people staying at home, but we're probably going to want to actually order most businesses to shut. We're going to want to have strict hygiene in public. So it's not just washing hands, it's going to be hand sanitizer whenever you're in a public place, say receiving medical care, and we're going to want strong social distancing rules. We're going to need strong test and trace on existing cases so that we can find out who's infected, find out who they may have infected and quarantine those people. And we're going to have to lock down the borders to anyone entering. We can't allow people to be bringing the virus into our community. Now, shutting down most of the economic activity in the economy is going to mean a big economic cost during the lockdown. Just to give you an example, Singapore, which pursued a very aggressive lockdown, has just released its last 3-month growth numbers, and it shows a 40% reduction in economic activity during their lockdown period. The lockdown itself is likely to raise the risk of distress and other health issues. Lockdown can be pretty hard on people, and we know that it leads to mental health issues and to other health issues. Finally, there's no guarantee that even an intense lockdown will lead to the elimination of the virus. Singapore, again, is a nice case in point. It did a significant lockdown, but unfortunately, it sort of missed a group of migrant workers who were living in close contact with each other in hostels. COVID-19 broke out among those migrant workers. Those migrant workers were still on the job, and that started a second wave of community infections in Singapore. Singapore, at least when I'm making this video, has not eliminated the virus. What are the benefits? Well, clearly a benefit in terms of a strict lockdown, probably limiting the loss of life. It's also likely that your health system is not going to be overwhelmed, so there's a minimum chance of overwhelming the health system. And once the virus is eliminated, you can sort of get the economy back to normal, recognising, however, that you're not going to be able to open the borders to people. You can open the borders to trade, but you can't let people come in because that can be a new source of the virus. As I'm making this video on the 15th of July in 2020, New Zealand is probably the poster child for the elimination strategy. It's been pretty successful at doing it, and it has been able to get its economy up and running again, albeit with very tightly controlled borders. The second and third endgames are going to be variants of each other. They all involve flattening the curve. In other words, bringing down that rate of total infections and bringing it down early. The first one I'm going to look at is what I'll call a hard flattening. What's the objective? Well, here we're hoping to reduce the exposure rate and the probability of transmission so that beta is less than 1 in the short term until we get down to an acceptable level of infections. Once we're there, we want to keep restrictions in place so that beta stays around 1. Our reproduction number is around 1. As we get more people who are immune, who have had the disease and recovered in society, that's going to bring down the number of new infections until the disease dies out. So how do we do this? Well, again, the initial stage, we're going to have pretty strong restrictions to get down the rate of infections, to contain the disease. Then, when we start easing those restrictions, opening up the economy, we want to make sure that we maintain a maintenance level. So we're not going to be able to fully open up the economy or the virus will take off again, or at least until we have a vaccine in place. Part of those opening up is going to be really strong test and trace. We're going to want to make sure the disease can't take off because it's still existing in the society. We're going to want to make sure that anyone with the disease is in isolation. If we have overseas people coming in, we're probably going to want them to quarantine for a period of time. There is a likelihood here of what's called the yo-yo effect, where the disease starts taking off, can't be perfectly detected, we notice the rate of infections going up, and we have to start clamping down again with stronger restrictions, perhaps locking down part of our society again. Particular buildings, as has occurred here in Melbourne, or particular suburbs, as has occurred here in Melbourne, or even re-entering a lockdown for an entire city, as we are currently in Melbourne. The costs, well, they look a lot like the elimination strategy. There's still the economic costs during the lockdown, although maybe the lockdown doesn't have to be quite as hard or to go quite as long as the elimination strategy. There's still going to be other health concerns, not only during the lockdown, but now the uncertainty is going to continue after the lockdown, particularly if we start hitting those yo-yo effects of having to re-lock down people. And that's going to cause a lot of mental health distress. And clearly there's going to be the ongoing disruption to the economy, at least until we get a vaccine. Perhaps unlike elimination, we can be slightly more open on our borders, but there's still that cost. What are the benefits? Well, as I noted already, you're probably going to be able to open up the economy a bit earlier than the elimination, albeit you're going to have ongoing restrictions. It's got a greater chance of success than the elimination strategy, so it may be more realistic, and you're probably going to get a low to acceptable loss of life. That might sound a bit harsh, but in a future video, we're going to be looking at the value of life. Endgame 3 is going to look a lot like Endgame 2. In fact, John Daly doesn't distinguish between them. He just refers to them as the flatten the curve endgames. But I want to look at flatten the curve softer. What's the difference? Well, again, we're trying to manage beta, that reproduction number, get that down initially, but then our maintenance, rather than trying to keep beta around 1 and letting the virus die out, it's much more, let's maintain a slower growing number of infections, probably until a vaccine comes along. So the real difference between the soft flattening of the curve and the hard flattening of the curve is that the hard flattening of the curve, yeah, you should be able to eliminate the virus and can potentially do that before the vaccine comes along. That's not really what you're planning for under a softer curve. Under a softer curve, you want a maintenance strategy until that vaccine arrives. For example, you might be happy with around 200 new infections a day, or 73,000 per year, or that's about 1,500 deaths per year at a 2% mortality rate. That sounds harsh, but in, say, a city of 5 million people, it's actually pretty small. And it would take 68 years before, at that rate of infections, everyone became infected. So you might be willing to put up with those deaths and that rate of infection for the benefit. What needs to be done? Well, very much like flatten the curve hard, you need to restrict movement, you need to get down to that acceptable rate of growth of new infections, then you have to have your maintenance strategy, but it's going to be a little less intrusive. However, again, you have that likelihood of a yo-yo effect because the virus is still in society. Similarly, the costs are going to be similar to flatten the curve hard, in the sense that there's going to be those significant economic costs while getting the virus under control. The extra probable cost compared to flatten the curve hard is that you're running a bigger risk of a second wave or future waves, the takeoff of that virus, if you don't have the test and trace in place to rapidly detect infections. And you can have that yo-yo effect with a continuing ongoing disruption to the economy. And what are the benefits compared to the harder strategy? Well, again, you're probably keeping to an acceptable loss of life, as I showed with those earlier numbers. In general, because you're not trying to get that beta right the way down to 1, you can open up your economy a bit earlier than the elimination or hard flattening strategies. Of course, you're going to have those ongoing restrictions, but they'll probably be less intrusive than if you're doing a hard flattening. And our final strategy is the easiest one because it's sort of a non-strategy. Let the virus run, let it take its course. What needs to be done? Well, you're not trying to lock down the economy and suppress the virus, you're letting it run. So really you just want to get hospitals ready for sick people, buy the relevant equipment, get the respirators in and so on, and get ready for your health system to be put under a lot of pressure. What are the costs of this? Well, a lot of people are going to get infected and many of them will die. What are the benefits? Well, you might get to herd immunity threshold before a vaccine arrives. Now, it's often said that this will lead to a minimal economic cost, but we've already seen that's wrong because we know that there will be endogenous changes in this situation. People will change their behaviour because of the existence of the virus, and that will have an economic cost. So there's potentially going to be a significant or a high economic cost, but the real benefit here is that hopefully that cost will only be borne over a shorter time frame. So these are our 4 endgames. What I want to do in the rest of this video is, rather than asking which one should the government choose, I want to show you a bit of what they look like in terms of some graphs. This first graph is just to illustrate the endogenous behaviour change. So we're going to use the same example we used in the earlier videos. So we're going to have a population of 10,000. We're going to start with 1 person infected. We're going to define a period of time as the length of time that it takes for 1 person who is infected to either recover and be unable to pass the virus on, or to die and be unable to pass the virus on. So our gamma is equal to 1 here. And what we've got on this graph is simply showing the total rate of infections under 2 different betas. Beta is 3 and beta is 2. So we can think of the let the virus rip strategy. In theory, it's going to be this line here. Very quick rise in infections, essentially everybody becoming infected, and a relatively short level of disruption, albeit that you're going to have 1 to 2% deaths, 100 to 200 people dying. But we know that's not actually what's going to happen in practice. In practice, people will change their behaviour because of the risk of infection and death. And that's what this second line is here for. Let's suppose that the drop in E as people reduce their social activity reduces the reproduction number from 3 down to 2. Then would be on this orange line here. Notice what happens is that we now reach a maximum number of infections, about 8,500. It's below the 10,000, the total population. It takes a lot longer, so the disruption is over a longer period of time. And notice that there will be an economic cost here because of the change in behaviour brought about by the virus. So really, when we're thinking about the endgame 4, that last endgame where you just let the virus run, we're really thinking about this orange curve, not the blue curve that you'll often see associated with that endgame. This second graph illustrates the importance of taking action early on. And we've seen that in practice. Countries that responded very, very quickly, for example, Vietnam, locked down its borders very quickly, no COVID-19 deaths. In contrast, the United States of America, many European countries, the UK, were much slower at shutting down their borders, much slower to act, a lot more deaths. So what we've got here is 2 economies. Both start off with a beta of 2, but the time when the government intervenes and brings down that reproduction number differs. In the orange economy, the government acts on period 4. I really shouldn't call them days because obviously they're periods of infection time. And in period 4, the government acts, reduces social activity and reduces beta down to 1.2. In contrast, in the blue economy, it takes until period 10 for the country to act and bring down beta to 1.2. And the result is pretty stark. In terms of total infections, which is what we've got here, you reduce total infection numbers by about 25%. That's going to feed through to people in hospital, and it's going to feed through to about a 25% reduction in deaths, simply by acting earlier. This graph looks at the same two economies, but now we're looking at the level of new infections. And you'll notice again what's happening is the country that acts late, it's really, the virus has taken off in terms of infections. We're on this exponential growth. Intervention, bringing the beta down to 1.2, can bring down the new infection rate pretty quickly. But in many ways, the health harm will have been done. What do I mean by that? Well, of the new infections, of the people who get the virus, let's say that around 5% need hospitalisation. And let's say that these countries are running a health system with about 1 bed per 1,000 people, or around 10 beds overall. Well, let's look at the country that acts early. Its level of new infections never gets up to 200. 200 times 5%, that would be our 10 beds. So this is a country where you never overwhelm the health system. In contrast, the country that acts late, well, in fact, it's acting after the horse has bolted. So the country that acts late, we're going to see its health system well and truly overwhelmed. In fact, it's going to be overwhelmed before it even takes any appropriate action. What does that mean? Well, the pretty undesirable sight of people not able to get the hospital care that they need, potentially makeshift morgues being set up in ice hockey rinks or in refrigerated shipping containers, mass burials, and we've seen examples of exactly that. We've seen examples in Brazil, we've seen examples in some states in the USA. This graph is just to point out the difference between the hard and the soft flatten the curve strategies. So the blue line represents a soft flatten the curve strategy in the sense that we have a beta of 2 until day 4 or period 4, and then the beta goes to 1.2. In the orange economy, we have a beta of 2 until period 4, and then the beta goes down to 1. And you'll notice that in terms of new infections, there's a hill for the country that does the soft flatten the curve strategy. The country with the hard flatten the curve strategy, they're getting in early enough so that essentially the virus never takes off. That's going to look a lot like elimination. That being said, notice that we're talking here of total infections, even of a country that has the soft flatten the curve strategy of around 160. So, we're talking perhaps about 4 people needing hospitalisation. So no overwhelming of our hospital system under either of these strategies, at least for these economies. This graph is really to illustrate the big difference in total number of infections under our different strategies. So the blue line is our strategy of let the virus run, even with endogenous changes in behaviour. So we've brought the beta down from 3 down to 2 due to changes in people's behaviour. The grey economy is our soft flatten the curve strategy. So beta is 2 until period 4, then beta is 1.2. And there's a pretty significant difference here in terms of the total number of infections, and also there's going to be in the total number of deaths. Our hard flatten the curve strategy is the yellow or mustardy coloured line here. Beta 2 until period 4, then beta equal 1. And the line right down the bottom, this orange line, that's our elimination strategy. So essentially that's with beta equal 2 until day 4, then beta equal 0.9. These last two graphs represent the yo-yo effect that I was talking about. So this is an economy where beta equals 2 until we get to day 10, so it's a bit late to react. Once it gets to day 10, however, it wants to pull beta down. It does a pretty hard lockdown. It pulls beta down to being less than 1 until the number of new infections gets below 10. Then it starts easing up on the economy again, the number of new infections goes up, and it gets up to around 100. When it gets over 100, the government reacts again, locks the economy down again, the number of new infections drops until it gets down to less than 10, then the economy opens up again, and so on. We've built in a couple of small changes in here, which a bit hard to see from these, but when we're looking at this downward phase, I'm going to assume that the government each time isn't quite as effective at stamping out the virus as before. So each time it does another lockdown, people are just a little bit more reluctant to comply with the government's requests, with the government's rules, and that's going to tend to mean that it takes a bit longer to get this infection rate down. However, there is an offsetting effect, which is really why you don't see anything here other than these spikes. The offsetting effect, of course, is that when the government reimposes restrictions, say over here, where it's for the sixth time, people are pretty sick of those, but also quite a few people have had the virus and recovered. So in a sense, the restrictions, even though they're not going to be able to enforce them as well, they're going to actually be more effective because the virus is starting to have trouble infecting other people. It's starting to reach that burn itself out phase. So those two offsetting effects, each successive lockdown is a little bit less effective because people are sick of it. They just don't socially isolate as much, and it's pretty hard to enforce, versus as the virus progresses, it naturally starts to have a reduction in the reproduction rate because more people have recovered from the virus and can't be reinfected. You can see that here. So this is the exact same economy. You'll notice that you've got a pretty much constant over time rate of increase in the number of total infections. But you'll notice at the beginning these oscillations are bigger. They tend to become dampened over here. And that dampening effect is just these offsetting effects in terms of the effectiveness of government policy. Some commentators have suggested that this yo-yo effect is the worst of all possible worlds from an economic perspective. So each of these oscillations involves businesses opening and then being forced to reshut. So the yo-yo effect creates a great deal of uncertainty, and there's real economic costs associated with that. For example, here in Melbourne, as I noted earlier, we've had a bit of a yo-yo effect. We've gone into a second lockdown. There are a large number of businesses preparing to reopen. They'd done orders. They had new supplies coming in the pipeline. They had workers coming back to work. And all of a sudden, all of that has to be reversed. That can lead to a great deal of wastage, as well as a great deal of angst within society. So I think there's something to the claims that this yo-yo effect can exacerbate economic costs. That's all in terms of the endgames for now. Next time, we're going to look at how the government can think about these and start making a decision as to which one or ones it wants to head for. Thanks for listening.